data from the American Diabetes Association shows about 3 million people in Texas have diabetes. Today we learn more about the disease in light of Diabetes Awareness Month. So joining us with more is Dr. Martin Ortega. He's with Texas Tech Family Medicine. Thank you so much for being on with us.
Thank you so much for having me. I appreciate the opportunity to highlight a condition that really affects so many of our community.
So this month, all month, Diabetes Awareness Month. Talk to us about why that's so important.
Well, it's really important, like you touched on, how it affects so many of our friends, family members, maybe ourselves. You know, within the state of Texas and nationally, close to 1 in 11, 1 in 10 people have diabetes.
Wow, so this is something good that everyone should be aware of because surely it affects someone in your family, just in case. So
sure.
Talk to us about the types of diabetes there are.
Sure, yeah, so it brings attention to diabetes in general. Usually it's divided up, speaking wise, of type 1 and type 2. Quickly, what that means is it just has to do with insulin. Type 1 diabetics, their body doesn't produce insulin, a hormone that helps regulate how your body manages sugars. Type 2 diabetics can eventually come to need to use insulin outside of the body, but that's highlighted by a resistance to the effect of insulins, and that's why type 2 diabetics, which is the more prominent form or the most common form, about 90% of diabetics are type 2 diabetics, can sometimes use medications, diet and exercise to help manage diabetes.
Okay, now talk to us about who exactly does diabetes affect?
Well, you know, there are certain segments of our population that might be more at risk for developing diabetes, but really there's no set patient. Type 1 diabetes does tend to affect people that are younger, but type 2 diabetes can affect younger individuals too. It is genetically linked, but it also has to do with our lifestyle. So unfortunately, with the rise of certain things like childhood obesity, we have started to see type 2 diabetes in younger and younger people. And so that's really, any one of us can eventually become affected by it.
Sure. Now, are there symptoms of diabetes if someone's concerned about something? What signs would be shown? Sure,
definitely. That's a great question. You know, classically, symptoms like having to be really thirsty, drinking a lot of water, eating a lot, seeing changes in your weight, both weight gain and weight loss, sometimes fatigue even can be signs or that signal the potential diabetes.
Either type 1 or type 2, those are the same symptoms?
Yeah, correct. Obviously, you see the age disparities. Like I said, type 1 is usually something that affects younger people, but the symptoms would be the same, even in older individuals who potentially could be developing type 2 diabetes.
Okay, now is there a good website that people can go to if they do have any more questions aside from this interview? Where can they go for that?
Sure, diabetes.org is the website, the official website for the American Diabetes Association, and it really is a great source for information for strategies on how to manage diabetes well.
Good.
And the focus of this month really is to just encourage people, bring attention to it, that they can manage diabetes successfully and that they're not alone in it.
All right, Dr. Ortega, thank you so much for being on with us and shedding some light on Diabetes Awareness Month.
I appreciate your time. Thank you.
Absolutely. All right, stick with us. We'll be right back.